Hello and welcome, Dr. Khaled Khorshid in California, USA, one of my old friends from Palmer College. And I had the unique privilege to meet a medical physician who was becoming a chiropractor just like me. And welcome, Dr. Khaled.
Welcome. I am so happy to see you after all these long years.
Almost 30 years, my friend.
Oh, I thought 30 minutes. Okay.
So we'll talk about our little discussion we had in Dr. Vern Hagen's class a bit later. But tell me, what did you do when you left Palmer College? Did you go to Kentuckiana?
Oh, no, actually, after I left, I didn't leave actually, because after I graduate, my plan was to go to Egypt because we don't have chiropractic in Egypt at all.
No.
So in Cairo, we don't have Cairo. So I usually say no Cairo in Cairo.
Is there anyone there now? Is there anyone there now, doctor?
Now they have few, maybe 5 to 10, not maximum.
Right.
For a population of 100 million, they have 5 or 10 chiropractors there.
Wow. So you stayed at Palmer College.
But anyhow, I felt on graduation that I was not strong enough in the physical therapy part. We did study some physical therapy. We passed the board, but I felt I am not strong enough in that field. So chiropractic needs some kind of physical therapy as adjuvant to help, especially in injuries, sport injury, and so on and so forth. So I was looking for opportunity, and I got actually opportunity in Palmer, residency in physical therapy.
Right.
So I did accept that, and was working with Dr. Clay McDonald. You know, he was the head of the department, and he was actually he was like the second or the third man in the college in administration too. So I stayed with him 2 weeks, but one day he came and said, hey, and he was laughing. He said, "We need you in something else." I said, "What do you need me for?" He said, "We need you to start a new family chiropractic department." I said, "What is family chiropractic department?" He said, "We need to broaden our spectrum and have our graduates join a diplomat program, which they can be actually so close to medical. And so we need you to build this bridge and have what we call family chiropractic. So you can take care of the people, both in medical and chiropractic. I said, okay, I have no problem with that. That means he terminated my my physical therapy activity, and he put me in the module 3 in the clinic. And so I had to do both, to work as clinician in the clinic and at the same time establish this new diplomat. It's supposed to be for 3 years. And after maybe a year or two, our president, resigned and passed away. Dr. What's his name? Our president? Huh?
Tatum?
You remember our president?
Oh, the president, Virgil Strang.
Yes, exactly. Dr. Strang resigned first. Then he got, after that, he had aortic aneurysm in the thoracic area, ruptured and died. But Dr. Rickman became a president.
Yes.
And when he came, he started to fire people.
Yes.
So he fired a lot of people, and it was chaos because all faculties were like expecting to be fired in any time. So it was like politically unstable situation.
I remember.
Yeah, you remember that. So I thought I should leave before I got fired myself. So that's what happened. so I got hired in Kentuckiana to be a clinic director there in Kentucky. And before I left, I met the assistant of the president, and I said, I love Palmer. I like to continue in Palmer. If you assure me I will not be fired, I will stay, but I have already contract in Kentucky. He said, oh no, we can't assure anybody. And then I said, okay, have a nice day. So I left and went to Kentucky and worked there for the children who have some needs. So it was a good experience because I had no much experience with children. Working in Palmer Clinic is mostly adults. So I said, this may be opportunity so I can learn pediatric chiropractic.
Wow.
So there, actually, it was a great opportunity because I discovered that we have lots of problems which I was not aware of, especially autism. And we had maybe 80% of the patients are autistic children. And I actually discussed Dr. Hagen about that. And he said, you know, you have a good opportunity to do research on chiropractic treatment for children with autism.
Yes.
I said, oh, that's a good idea. He suggested I contact the Atlas Orthogonal leader, you know.
Yes.
Of course, you know him.
Right.
So
yes.
That's what happened. Exactly. So I contacted him and we planned to do a research. And actually, it was a wonderful research. It was published in the subluxation journal.
Oh, okay.
Published. I made the research. Yeah, I made the research in 2002, and it was published in the 2006. So between 2002 and 2006, I have been invited to many places in the United States to give lectures about the research I did. And it was a wonderful opportunity to meet many people and go many states. So that is how it is. But in fact, after that, I decided to work for myself. So I opened the first office in nearby Chicago, in Moline Airport in Illinois, a little village called Orion nearby there. So only 1,800 people there in this village.
Wow.
So that was my first office. And then I moved to Chicago itself, and I had a bigger office in a medical center.
Wow.
So that office from actually 2003, 2003 until now. And 10 years ago, I got another second office in a city called Evanston, nearby Northwestern University. So now we have two offices. So we have been working very good in that office. And 7 months ago, I retired completely. I left the offices for my daughter, who is a chiropractor, but graduated from National University of Health Science.
Oh, that's fantastic.
So she is now taking care of my patients. They are happy. I'm happy. I didn't leave until I'm sure everybody's happy. So
that's great.
Yeah, I don't want to feel that any patient I am actually like dumping them for unsure future, but actually they are happy until now, and I'm still communicating with them to be sure they are okay. And this is a wonderful opportunity to relax. In my age, I'm now 71 years old.
That's lovely. Now, I got a message from Dr. Darren Shiner years ago, and he came back from Palmer, and he said to me, I got a message from Dr. Khaled Khorshid. I said, oh, really? That's interesting. What did he say? And Darren said to me, tell Joe he was right. Now, what were you talking about? We were in a debate together about vaccination. Shall we discuss that or not?
Actually, when I was debating with you, that was my new arrival to Palmer. I was like in the first months of my existence in the chiropractic world. So imagine somebody 20 years practicing medicine and surgery and oncology, and his brain is organized in the way every medical doctor know how vaccine is good and all the history of vaccinations and the routine use of vaccine, which is actually mandated for everybody, children and so on and so forth. So that is my brain, how it was. So I was shocked when I see somebody say, hey, no vaccine, we are against vaccine. For me, it was like, oh, that's a different world.
Yes.
So I couldn't help it except to debate as pro-vaccine practitioner. So,
yes.
so
well,
that
it was a debate. It was a debate. But you say you changed your mind.
Actually, definitely, because
wow,
by my practice, especially when I went to Kentuckiana, and I discovered that all these autistic children were already okay in the milestone of development. Parents tells me once they got the triple vaccine, they deteriorated. The child who was walking stopped walking. The child who was talking stopped talking. And they were accelerating in the process of autism symptoms and signs. And the condition is not getting any better since that. So like everybody swear that things happen after the vaccine. So I started doing research, and I joined a group of doctors from different specialty, and they have a research center actually here in San Diego, California, the Autism Research Center here in this city. And they have a conference every year under the title, Stop Autism Now. So doctors from all fields, from pediatrics, biochemistry, science research, chiropractors, MD, internists, and difference. So, and everybody have no doubt that the vaccine is behind the sky high or the rocket high of incidence of yes. So to the extent the Congress have discussion on that too. Some of the congressmen, their grandchildren are autistic, and they hear about the autism and they hear about the vaccine and so on. So they demanded research to be done to see if any relationship. So they made the research in the state of Illinois to find out if there is any relationship. But the result of the research say no relationship. So
yeah.
So that's what happened. I think I should put the charger, otherwise I'll miss you. One moment.
Well, that's some astounding research, some very disturbing kind of denial of what I've seen in practice as well. I haven't seen 1,000 children that are vaccine injured, but I've seen enough that they were the parents that were telling me, and some of their doctors admitted that it was related contemporaneously, and it was in a definite causative timeline. And it seems like that's another aspect of the truth that has been suppressed. And I knew you were at Kentuckiana. I thought that was a wonderful thing, but it must be a little bit frustrating to you that the truth really has still not been told. And I've just lost you there, but basically we're just waiting for Dr. Khorshid to get back online. And I can say that we had a debate in our class that was led by Dr. Vern Hagen, and he said to us that we would be taking a side on the vaccine debate, and we may have to reconnect with Dr. Khorshid. I'm just going to try and do that now.